Okay, for my senior project, I crocheted NICU blankets, and this is one of them that I will be donating. This is it finished, and that's also a picture of this one finished. And so, holistic care in the NICU. Holistic care in the NICU goes beyond medical interventions and includes compassion, family involvement, and specialized care to support survival and long-term health. As part of my dedication to this cause, I crocheted blankets, emphasizing the importance of comfort and emotional care alongside medical treatments. About 15 million babies are born preterm each year, which is about 1 in 10 worldwide, and preterm infants are considered anything below 37 weeks gestation, and that is a graph showing 1 in 10. Okay, key aspects of NICU nursing are family involvement, which includes supporting families emotionally and encouraging them to have active participation in their care of their infants. Infection control is another big one, which includes strict hygiene protocols to reduce the risk of infections in preterm infants. And pain management is another big one, which is using pharmacological and non-pharmacological methods to minimize discomfort during procedures. Okay, the role of family-centered care includes emotional support, parental presence, education and training, and communication and support services. Emotional support for the families is counseling and support groups that are provided and resources to help manage stress and anxiety. Parental presence is encouraging active participation in care like skin-to-skin contact, as we can see in this, which is also known as kangaroo care, which helps their bonding. Education and training includes teaching the parents how to care for their preterm infants and training them on necessary at-home medical procedures. Communication is open and honest discussions with the families and involving parents in medical decisions. Support services include access to social workers, lactation consultants, and other specialists, and providing accommodations for families near the NICU like Ronald McDonald houses. Infection control includes strict hygiene protocols, which are regular hand washing and hand sanitizing, and the use of gloves, masks, and gowns when and if they are needed. Sterilization of equipment includes proper sterilization of all medical tools and the use of disposable items to reduce contamination. Environmental cleanliness includes frequent cleaning and disinfecting of surfaces and maintaining a clean and organized environment. Monitoring and screening includes regular infection screening for infants and staff and isolating infected or at-risk infants to prevent spreading. Education and training includes teaching staff and families infection prevention methods and ongoing training in the latest infection control practices. Pain management has 4 main ideas, which are pharmacological methods, non-pharmacological techniques, minimizing painful procedures, and monitoring pain levels. Pharmacological methods include administering appropriate pain relief medications and using sedatives and analgesics as needed for procedures. Non-pharmacological techniques include swaddling and gentle rocking for comfort and the use of sucrose on pacifiers for minor procedures. Minimizing painful procedures include combining procedures to reduce the infant's distress and using the least invasive methods when possible. Monitoring pain levels include regular assessments using standardized pain scales and adjustments to make their pain lower. These are the blankets. This is the yellow one before I finished the border. And then I have since worked on this one and it is almost done with the body and then I'll do the border. And this one is still about like halfway done. In conclusion, Through the combination of family-centered care, infection control, pain management, and handmade donations, their improved outcomes are almost a guarantee for NICU patients and their families. Any questions?
Do the blankets have to be made out of any certain materials or certain patterns or anything?
Yes. So the blankets, there's like a specific list of yarns that you can use that are safe for the babies, and you have to do tight patterns and not lacy ones so that their fingers and tubes don't get caught in the holes.
And about how long does it take to make one blanket?
This blanket took me probably like 20 hours. I've been working on it for a couple months. But if you look at it, it makes sense because each of these, it's like this is a row and then this, and it goes like the rows are tiny because the stitches have to be so tiny so that there aren't holes. And it's a lot of stitches. Any other questions?